Hi, Dr. Mike Carberry here to talk to you about advanced medical integration and our upcoming convention. It's not so much just coming to the convention, it's why we're having the convention that I want to talk to you about it. First of all, let me get it out in the open that it's April 26th and 27th. It's in Orlando at the Portofino Hotel at the Universal property, which is an extremely nice hotel. And if you're interested to join, I'll give this number many times throughout, and it's behind me as well, but 888-777-0815, and call to get registered for that. So I'll tell you what we're going to talk about, and then I'll go into more detail about it, but we're going to have a lineup of speakers, and we believe that we can make a movement in healthcare that will make healthcare less focused on chemical remedies and more focused on the true causes of disease. If you look at all disease, it's either spiritual, physical, or chemical. And if you look at the amount of physical stress on somebody's body, it's overwhelming. Johns Hopkins University said that the amount of stress, physical stress on somebody's body, they said mental, chemical, and physical, somebody in 1 month has more stress in all three of those areas on their body than their grandparents had in their entire lifetime. And if you look at that, you go, well, I understand chemical and I understand mental. Mental stress, where everybody's walking around with cell phones and little computers in there and communicating with everybody at the same time. There's mental stresses that come with that. And we live in a chemical world. There's lots of chemicals that are being made. The average person is exposed to like 80,000 chemicals a week. So if you look at that, you go, yeah, there's a lot of chemical and mental stress, but what about physical? Well, Johns Hopkins said the physical stress, yes, we're experiencing more than that than our grandparents did in an entire lifetime in 1 month. And the reasoning for that is the type of injuries we have. Yes, people worked hard 100 years ago and physically used their body and had a lot of physical stress in their body, but they weren't in a car wreck that had force at such a high level. My grandfather, he was born in 1900. I think he got his first car in the early 1950s, maybe like late 1940s, which means he was like in his 50s when he started driving. I don't know if he was ever actually in a car wreck, but I know as a driver, I was probably in sixth in the first 5 years of driving. Motorcycles and doing stupid things that guys do when they're younger. The average American has one every 2 years. The average American has their first car wreck within the first 2 years of getting their license. And then I think it's every 7 years an American experiences a car wreck. Well, if you look at a car wreck and the force that's behind there, it's the mass of the car times the speed. So it's not like falling off a horse at 20 miles an hour. It's like hitting a 4,000 pound something at 20 miles an hour. The equation, the mass in the equation, because remember, force equals mass times acceleration, right? Let me just draw that out for you. Force equals mass times acceleration. Well, this is the component that got way bigger, and so did this. You have more mass because we're driving around in vehicles that weigh anywhere from 4,000 to 7,000 pounds, and we're going speeds that are like 10, 20, 30, 40, 50, 100 miles an hour. And if you look at that, something weighing 4,000 pounds going 20 miles an hour is 80,000 pounds of force. If you look at the average person, 200 pounds, right? And they fall off a horse at 20 miles an hour. 100 years ago, that's 200 times 20, you're talking 4,000 pounds of force. So it's tremendously different forces acting on our body. And what takes the brunt of this? The spine. What's the number one reason for the average American to be in a hospital? First is being born, second is back pain. Back pain and chronic degenerative arthritis is the number one ailment that human beings suffer with in this country. It is it's the second reason to go to the doctor's office. Number one, I believe, is common cold. Number two is back pain. So you look, back pain is way up there in causing problems and having people seek care. And what are we getting for it? We're getting chemicals. And what are the chemicals we're getting? Well, we're getting opioids. And we are consuming 90% of the world's opioids. We're 4.6% of the world's population consuming 90% of the world's opioids. And just in the last 2 years, I believe, opioids became the leading cause of death for Americans under the age of 50. You look at that and you go, that's insane. That is insane. That also means a tipping point. That means for the first time, Our competition, the pharmaceutical industry, has actually become the leading cause of death for Americans under the age of 50. Now, I suspect they've been that for a long time, but officially now they are. You look at that, you go, Americans are starting to realize, I don't know if I want to be put on an opioid because my cousin got an opioid, then he got addicted to heroin, then he ended up dying or whatever. And everybody knows a story like that. So there's a tipping point. At the same time, we have medical doctors, a lot of them getting frustrated with care. Why? Well, a family practitioner, in an article in the Wall Street Journal in 2014, they asked 12,000 family practitioners, do you like your career? Would you do it again? And 94% said no. And I believe the reason for that is they have to rush through the visit to make a profit because they're only getting paid an E&M code for it. They're seeing like 40 to 50 people a day. Who can keep that straight? Doing an exam on somebody you haven't seen in maybe years to try to figure out a problem that you never saw them with before and trying to cure it on the first visit. That's what they're up against. These poor doctors are so stressed out from that. They're writing script after script trying to help these people and they can't keep up with it all. And they get frustrated and they get tired of it all. And that's because it was all designed that way. That was the standard of care designed to get doctors to sell more drugs. Who did that? Well, I believe it was the American Medical Association, which has a very low enrollment of medical doctors, to get people to join. I mean, to have doctors belonging to it because they're funded from pharmaceutical pockets. That's my personal belief, and there's a lot of evidence that, a lot of articles out there saying the American Pharmaceutical Advertising Council has been the biggest funding source by the AMA selling the records of their doctors that they keep records on to pharmaceutical companies to market to them. They make a ton of money on that. Owning the billing codes. The AMA owns the billing codes, and they're tied in with the pharmaceuticals. And everything leads to a drug. So the standard of care, everything leads to a drug. And I think there's a lot of people in the medical world that are getting frustrated. So you should come to this convention because we have a movement to change all that. If you're a client, you need to come to this convention. If you're not a client, you need to come to this convention. If you're not a client, call that number, 888-777-0815, and tell one of my people you want to come to the convention. Now, we're going to charge you for it because we have some great guest speakers. We have Grant Cardone speaking. We have Tim Grover speaking. We have John Rosa speaking, Dr. John Rosa. So phenomenal people that are just really, they're going to show you that there is a way to solve this problem. There is a way to actually put sanity back in healthcare and a way to get your business to grow. Like one of the things that Grant's going to talk about and one of the things that Tim Grover is going to talk about, they're experts at scaling your business. The only way you can scale your business is to get systems in place and get other people performing underneath of you in a way that you're satisfied with. If it's not a way you're satisfied with, who wants to do that? Nobody. But if you're going to scale a business and be successful at it, you have to get others to perform in that business, delivering services to your standards, right? And when you do that, all of a sudden you don't have to be in the trenches doing all the work because it's a big job orchestrating the whole play or the whole orchestra. You deserve to be rewarded for that. If you create a clinic that coordinates the medical world with the rehab world, physical therapy world, and the chiropractic world, and everybody's working together, trying to fix healthcare problems, and not just using just chemical means of doing it, but a lot of physical means of doing it. That's what AMI stands for. That's why we're in existence. It's been my dream since I got injured back in 1986, and I was faced with how do I deal with this injury, and I had a lot of great advice from great people, people I respect even to this day, who wanted to help me, but they were very steeped in the pharmaceutical industry, family members who were in the pharmaceutical industry. That was all they knew. They never looked at it from another viewpoint. This monopoly that is going on in healthcare right now and has been going on for the last 120 years basically has people not even thinking there's another option. But if you look at it, physical is more of a common cause of disease than chemical imbalance. Now, the more chemicals we have brought into the world, the more chemicals we're creating, the more that's going to change. But physical still, I believe, is one of the leading causes of disease. Probably the biggest cause of disease is mental or spiritual. You just look at that, you look at a husband and wife who are married 50 years, and one of them dies, the other one usually dies within 6 months. That's because of a spiritual, emotional connection. So what's the best way to handle that? Well, balance somebody physically, balance somebody chemically. You cannot balance somebody chemically with drugs. You have to balance somebody chemically with nutrition. And we don't do that in healthcare in this country. So how long are we going to stand by and let this go on the way it is? Chiropractors, if you're listening to this, you've been trying to preach an idea of healthcare that includes nutrition, includes physical medicine, includes exercise for the last 130 years. And we've gotten less than 10% of the population to buy into it. I think it's time we try something different. Working together, I am blown away how many medical people are loving the idea of us all working together. You know, when I first started as a chiropractor doing the integrated model back in the mid-90s, I thought I was going to run into a lot of opposition from the medical world, and I didn't. I ran into some, but you're going to get that in any profession. But most people are going, you know what, we should all work together. We should all do what we do best to contribute to the better outcome. And I had a lot of medical doctors and nurse practitioners tell me they wish they had more tools other than writing a prescription to help people get well. Well, that's one of the things AMI does, is it shows those tools. And the funny thing about it is, those tools were created by medical doctors. Great doctors like Janet Travell, who treated John F. Kennedy with trigger point injections and joint injections, or Vladimir Janda, a physiatrist from Czechoslovakia, a medical doctor who specialized in physical medicine, or Rene Callier from Southern California. People had ideas about physical imbalances causing disease and causing health problems. So AMI is all about coordinating those different branches of healthcare to work together to balance these physical causes of disease. And if you look at it, you go, well, how big of a percentage of the market is that? Well, if you look at the number one reason people are in the hospital after being born, it's back pain. And back pain is only one segment of chronic degenerative arthritis. So this is in our wheelhouse. Who better to coordinate this movement to balance these physical imbalances that lead to disease? You know, we're not saying we can cure everything or anything. What we're saying is that whole mantra of, oh, you have to have a drug and be able to cure a disease. Well, I don't know of many drugs that cure disease. Do you? I don't. It's just the way the laws are written. What we do is we say, let's look at it from a different viewpoint. Let's balance this body and let the body fix itself, which is the way it was designed. Yeah, is stem cells part of that? We do some stem cells. Is rehab part of that? Yeah, we do a lot of rehab. Is chiropractic part of it? Yes, we do a lot of chiropractic. Are other injections part of that? Yes, they are. We do lots of different things, lots of safe things, non-invasive things to help people avoid drugs and avoid surgery, especially the opioids. This convention, Dr. John Rosa, he's a surrogate on the White House Committee of Opioid Abuse. He's also a consultant for DEA and Homeland Security. He's also a consultant for the Maryland Opioid Task Force. And so he's going to speak to us about how coming up with an alternative for these leading problems that lead to opioid abuse and opioid addiction. The only way to solve this problem is to come up with an alternative. A lot of money, he said, in Washington is going towards drug abuse and rehab and going towards law enforcement, but there's not much being done to prevent the prescription, and doctors don't know what to do. They were only taught one thing. So let's teach them something different. Let's get them to work with us, because I will tell you, most medical doctors I've met in my career had the same original purpose to get into medicine that chiropractors, 80% of chiropractors I know, had, and that was to help people. You know, it's just a small minority of doctors who are actually very antagonistic towards other groups. Let's not be in that group. Whether you're medical, whether you're chiropractic, let's not be in that group. Let's work together. Come to this convention. Hear these speakers speak. Grant Cardone, Tim Grover, John Rosa. I'm going to speak, and I'm humbled by the presence of these other giants that I'm going to be speaking with. We're going to have other great speakers, great doctors talking about functional medicine, talking about things like how to market your practice or how to help with things like neuropathy. This is all going to be presented at this two-day convention, April 26th and 27th in Orlando. So hopefully I'm appealing to you. It's really important. This is going to be one of the biggest things. We can change healthcare. We can change it right now. It's within our grasp to change it. The opposition went too far. We need to stop fighting with each other and realize our true opponent is the people that put out studies that said opioids are not addictive. That's our true opponent, because they are addictive. And it's a crime. It's a crime that this has been done to the American public. It's a crime now that so many people are dying from these drugs. It's a crime now that, the number of people in prison who would have never dreamed of going to prison got there because they started taking a substance that the doctor who prescribed it believed was not addictive because of payoffs to Congress and payoff to whoever in the government to allow these things to become standard. I mean, when did we need heroin or drugs in that class to be standard prescribed drugs. That's ridiculous. If you said that 100 years ago or even 20 years ago, the people you said it to would say, oh, if you do that, you're going to make a bunch of junkies in this country. Guess what happened? So we need to change it. Sitting around doing nothing is not going to change it. Sitting around saying, I don't have time to do it, is not going to change it. Do something that can help change healthcare at the same time, can help you create time in your business to have time for other things, like your family or other businesses. A lot of times my wife and I get asked, how do you guys run 6 different businesses all across the United States? How do you do that? Well, there's ways. You have systems. And one of the things that AMI teaches is systems. You have to have systems to be able to expand. If you don't have systems, you can't expand. You'll be limited to the amount of work that one person can do, and that person will be you, and you'll go to the grave dying from work. I don't want to end up that way, and I don't want any of you to end up that way. I think what we could do is make this shift in healthcare, and when people start to realize it, you hit that pivot point. And I've heard many authors say the pivot point is 15%. We're 5% away from that. We get that pivot point, we start to get people to realize, you know what, I don't need to go get surgery first, I don't need to go get opioids first, I might have to do that as a last resort, but the first thing I should do is something like this, something that advanced medical integration teaches and should be the standard of care, because what we're treating is one of the most common things that people suffer with. And what we've learned is if you address that correctly, other things get better also, and we'd have a lot less ailments. We don't want to have a sick country. The only people who want to have a sick country are the people that are selling the remedies and getting very rich off the sick country. Let's end that. Let's save our future. Let's make this a better world for our kids and our grandkids. And let's create an environment where people are healthy and happy and prosperous. And that should start with you. So hopefully I'll see you in Orlando at the Portofino Hotel on April 26th and 27th. Call that number, 888-777-0815. Tell my staff you want to come. They'll tell you what the charge is. It's not unreasonable. And I need to see you there. Come support us and come support you, yourself, and your profession.